So we're going to start with a technique called Effleurage. It's a really core, fundamental technique for any sports massage therapist. The rationale and reason for using this technique will be for different reasons depending upon the pressure and the speed at which you're applying the technique. So when used slowly and really quite lightly without much pressure, it's good for lymphatic drainage. With speed, it's really good to invigorate your patient, so good for things like pre-event massage. And then with medium pressure, it's good for venous return and good to encourage more blood flow. And then finally, with deep, concentrated pressure, it's good to really reduce muscle tone and relax the patient. In terms of how we're going to use this technique, then posture is really quite key, and you can see we need to use our body weight, transferring our body weight from our back leg to our front leg, and it should really be a transference of pressure, and our body should be in conjunction, in connection with our lower extremity. So there are 5 main different types of effleurage, which will be dependent upon the size of you as a practitioner, and also the size of the limb that you're going to be treating. So the first one, which would be good for things like calves and biceps and triceps, would be a single-handed technique. This is where we've got hold of the anterior ankle, and then with one hand we're applying pressure up, distal to proximal, retaining contact on the way down, but it's nice and light just to maintain contact, but all the pressure's going up distal to proximal, and we're using 2 main different hand positions. The first one being our web space, with thumb and first finger on the lateral tissues and pressure moving up through the length of the tissue, and our pressure is being applied all the way up through the length of the tissue from attachment to attachment. The other technique we can use for a single-handed one is using our ulnar border, where pressure again is being applied up longitudinally, but we're using the ulnar border of our hand rather than the web space. So it's personal preference as to which one you use, because they're going to be applying same levels of pressure and have the same sort of size of limb. If you want to apply more pressure, then you can use a single reinforced technique, which is where you can use the same applicator, be your web space or ulnar border, but your opposing hand is just applying a bit more downward pressure. So that pressure coming with my left hand on top of the right hand, and same technique where we're running up attachment to attachment, but we're applying more pressure with that left hand over the top of the right hand. So good when you want to really induce a much deeper relaxation into the tissue and get a bit deeper into the tissue to try and reduce tone. If you've got a bigger muscle group like hamstrings or quads, then a better applicator will be using 2 hands or a double-handed technique. And with this you can see we're getting much more coverage, 2 hands, still the same transference of body weight from back leg to front leg, but with 2 hands you can see we're getting a much wider distribution of pressure from attachment to attachment through there. So that will be an example of a double-handed technique onto the gastrocs. If you want to apply effleurage techniques with a bit more speed, so for things like pre-event massage, then we can do a double alternating technique where we're moving hands in an alternating fashion, pressure again being applied up in the same direction, but you can see it can be applied with a bit more speed and with the depth that you feel is appropriate for your patient. So we could use web space, or we could use our ulnar border again as before. So that's a double alternating technique. And the final one, where if you want to get much deeper into tissues over perhaps a well-muscled limb, if you're a smaller practitioner as well, you can use a forearm. So always have your hand lateral to the limb you're working on. You can use either your ulnar here, or you can use your flexor compartment, pressure coming down, making sure your back's really nice and straight, and we're transferring our body weight from our back leg to our front leg, still retaining contact with the patient on the way back, but a much easier way to apply more pressure with an effleurage technique using your forearm. So you can really mix and match those techniques depending upon what you're trying to achieve with your effleurage technique. But it's a really good way to start sports massage because it gets the patient familiar with touch. It also lets you palpate, so as and when you find tight bits on the tissue you're working on, then that will determine how the treatment progresses. If you find more tension medially, you'll then progress treatment in towards the medial tissues with petrissage or more progressive techniques.